Hi, my name's Joanna Prendergast. I'm a psychiatrist in New Zealand and also a breast cancer patient. I'm in the middle of chemotherapy and I'm doing something called cold capping to reduce hair loss. I put together this film to provide more information about cold capping, and I hope that eventually it's something that everyone will be able to access. Cold capping involves wearing a special type of hat on your head to cool your scalp on your chemotherapy days. This reduces the blood flow to the hair follicles, and this helps to protect your hair during chemotherapy. The goals of cold capping are firstly to retain as much hair as you can, secondly for the hair to grow back faster and thicker, and thirdly to reduce the chance of permanent hair loss. There are two well-researched types of cold capping that are available in New Zealand. The first is the Paxman scalp cooling machine, where your cold cap is connected to a cooling machine before, during and after your chemotherapy. The cold capping is all done in the hospital, and Paxman machines are available in several New Zealand hospitals. You wear an inner cap that circulates cooling fluid, then an outer cap holds it in place. The other option is hiring Penguin manual cold caps, and these can be used in any hospital. The caps are cooled in dry ice in a cooler, and the temperature of the cap is checked. Your helper then fits the cap to your head, and they change it for a new cold one every 20 to 30 minutes. The cap changes can be done at home before and after your chemotherapy infusion.
I think I've got a pretty normal pain threshold. It's not that sore, it's just uncomfortable. It's kind of like an ice cream headache while wearing a tight batting cap. And then basically you get used to it and the anti-anxiety takes the edge off, and I'm just quite relaxed and kind of boring for quite a while. And it's another hour and a half, I think, after my treatment for that particular regime. So it's a good 4.5 hours. When I went back for my second session, I'd read a bit about cold capping, and as much as I needed, but not massive amounts. The nurse, the first thing she said, who was not very experienced with the cold capping, not many people had used it yet, she said, "Oh yeah, you would have lost most of your hair by now."
We did this every week for 12 weeks, and as you can see, I had absolutely amazing results. It wasn't exactly comfortable. It added on additional time to what it would usually take for the average person to go on and have chemotherapy. But at that stage, I was so determined to keep my hair. I would have done absolutely anything to keep my hair. With the discomfort of cold capping, that was absolutely nothing in the big scheme of things.
So I'm going in for my second chemotherapy today, and I've just had this cold cap put on. It's my first one for the day. It goes on about an hour before my chemotherapy starts. And the first 10 minutes of the cap being on can feel a bit cold and uncomfortable, but I've found it remarkably easy to tolerate. It's just getting to the stage now that I'm not really aware that it's there.
For me, it's not about vanity. I don't like drawing attention to myself. There is a bit of that, but I don't wear much makeup. I brush my hair each day. I'm not that funny about those things, but I just wanted to stay feeling like myself. It gives me a sense that I will have done everything I can to stay as normal as I can during this whole process, because so much of it is outside my control. Knowing there are some things I can do something about makes a big difference. And given the shock it's been for my family as well as for me, anything that can have them not be constantly reminded that this is going on is a good thing.
I'm a very private person, and I was able to choose the people that I could tell that I had breast cancer and I was undergoing this treatment. People would look at me and they couldn't see any difference from the old Anna and the Anna with breast cancer. So people treated me exactly the same. I got no pity from anyone. I basically could look in the mirror and see my old self, and that was very important for me, for my self-confidence and my self-esteem, to still feel and still look like me, and therefore I could protect my son from knowing that I had breast cancer and that I was very sick. He didn't know that I had cancer because I still looked like mum, and that was very important. There needs to be a lot more awareness about cold capping, whether it's from a machine like the Paxman machine that I was lucky enough to use in a private hospital, or whether it's manual cold capping, which also has amazing successful results.
I'm now 7 weeks after my final chemotherapy with TC chemo, and I've been lucky enough to keep quite a lot of my very fine thin hair, and I'm sure it's helped my mental health, because I think the thing that really scared me about going through chemotherapy was going bald. I felt that was something that would negatively affect my mental health, and that I had enough to deal with already going through chemotherapy without dealing with hair loss grief. And the main reason that I've made this film is to increase awareness about cold capping, and that I hope that eventually affordable cold capping will be available to all New Zealanders going through chemotherapy.